So good morning ma'am, my name is Krisia Mhel, and for today's video, I'm going to demonstrate how to assess our patient's breasts and the axilla po. Prior for the assessment, of course, do not forget first to introduce yourself, verify the client, and to explain the things that she needs to do so that she can adjust and she needs to coordinate po for the assessment. And then do not forget to do hand hygiene and to provide for patient's privacy and ask for the following questions like kung may history ba siya ng pananakit sa kanyang dibdib, lumps, or lesions, ganun po. So next is to provide our client in a sitting position and then inspect for the breast size, symmetry, the contour. The contour the color must be uniform to the color of the abdomen and for the axilla part. Inspect for the skin discoloration of the breast. Kung may nakikita kang swelling or inflammations, of course, we're going to check it. For the edema, ganun po. So stretch mark is normal and in the breast, it is normal. So we're going to emphasize the retractions of the breast. So magagawa natin yun by placing our hands at the back of the head, like this. And then, by pushing our hands together and flex our elbows, ganyan. And then, by placing the hand on the hips, ganito po. And then, by leaning forward, ganyan. Is to inspect the areola for the size, the symmetry, the contour for any lesions or masses presented. For the nipples, size, symmetry, contour, shape, the characteristics, and for any discharge. Next is we're going to assess our client in a sitting position with the arms abducted and of course supported by the nurse, him or her like this. And we're going to locate the axillary, subclavicular, and supraclavicular lymph nodes. So place again here and then here, there. Next is we're going to palpate for the breasts, for the tenderness, inflammations, and for the discharge of the nipple. So we have the three kinds of patterns on how to palpate our breast. First is the hands of the clock pattern, concentric circles, and vertical strips. Palpate for the areola and for the nipples. Ipapalpate natin siya and then press the nipple, assess if there is any discharge, and if any, kailangan natin isulat kung the color, the consistency. Kung gugustuhin ng pasyente, teach them the different techniques or patterns for the self-breast examination. And of course, lastly, do not forget to document the findings in the client's record.